Okay, well, I want to first start off with a question that is in everyone's is that with Jersey City soon to become the most populated city in the state with an additional 30,000 residents, how are we to prepare for a health emergency in this region as we lose Greenville Hospital and St. Francis Hospital we lost, and the quicksand condition of Christ Hospital, Jersey City Hospital, which is the medical center, Bayonne Hospital. And we are in an area of the Northeast where we are, you know, if they're going to attack New York City in terms of crisis, Jersey City is going to be attacked in terms of we ever have a problem like 9/11 again. So what is your proposal?
You're right, Yvonne. We have as much as we have a property tax crisis in the state, the other crisis, which is almost eclipsing it, is our health care crisis. Just last week, I put together a bill, the New Jersey Managed Care Health Board Act, which basically will have to undo managed care. One of the problems is managed care, many years ago in the 80s, came in to solve the health crisis at that time in the state. It worked well for a couple of years, but now it's out of control. And what's happened is insurance companies have monopolies in this state. They are raking in hundreds of millions of dollars in profits, and they're not sharing that with the industry. There's no competition. They routinely deny hospitals, other doctors, and even insureds routine payments that they're on bills that they're owed for health care. And they do this because they know an individual can't go out, hire a lawyer, or an accountant for that matter, to fight them. So what happens is, in the case of a hospital, they have to cherry pick. They have to say, at the end of the year, we have $100 million of outstanding bills that the insurance company won't pay us for. We can't have a lawyer go in and fight every one of these bills. Let's cherry pick. Let's see which are the highest ones, and then they have to eat what they don't challenge. That eating of what they don't challenge is causing them a deficit every year. The state tries to prop up the hospitals by sending additional aid in, and the insurance companies get off scot-free. So my bill does a couple things. Number one, it dissolves managed health care. No more networks. You basically get an insurance policy. It covers you for any doctor and any hospital you want to go to. So an insurance agency like a Horizon or an Aetna can't say we have all the hospitals in our network and all these doctors and you should come to us for business. What this does, it says you have an insurance policy, any individual can go to any doctor, any hospital they want, and now the companies must compete for your business.
Okay. One of the problems you have, especially in Hoboken, in Bayonne, is the fact that doctors cannot afford the health care coverage, liability insurance, and there's actually no babies being born actually in the Bayonne area. And I went on a march when the doctors protested 2 years ago in D.C., and they're graduating from our schools and they're going elsewhere where there's a cap. So, and the lobby in Trenton does not want to address this because of their relationship with lawyers.
I was one of the co-prime sponsors on the medical malpractice cap bill. And you're right, it's a lobbyist thing. But the management, the Healthcare Management Act bill that I put up does a couple of things to help alleviate that. Number one, it mandates that all doctors, private physicians, as well as these private health clinics in our community, must do at least 3% of their business with uninsured clientele. That helps reduce the charity care volume on the hospitals. But secondly, it enables someone who's a doctor who's willing to take 30% of their business as a uninsured, the ability to get reimbursed from the state for their medical malpractice insurance, which becomes a tremendous incentive to do that, number one. And number two, will reduce the volume of uninsured patients being treated now by hospitals and being paid for by the state budget. So by having the industry, the healthcare industry, if you will, address this, it puts more money, it makes more money available, and brings down the cost overall of healthcare. A very important thing to note is that what managed care did, and think of this, Right now, the people in managed care, the guy who tells you what doctor to go to, what network to set up, they're eating 20% of the cost of an insurance premium. So if you're paying a dollar, every dollar you pay in an insurance policy, 20 cents of that goes to this managed care network for its administrative cost, which is got to be the highest in the nation, and it's ludicrous. And that's why we need to dissolve it, and we need to get to programs where we can make health care more affordable.
Okay, well, to change the topics, I
About one other thing,
Sure.
thing I wanted to point out about that. There's a major reform on how a premium is set. Right now, if you go to a doctor, or not a doctor, if you go to your insurance agency, they ask you a series of questions. How old you are? Do you smoke? What's your family history for this disease, that disease? And then they pull out an actuarial table, and they'll tell you, well, based on your family history and all these questions you answered, your premium is going to be X amount of dollars. Well, then you pay that premium. And that premium is then invested by the insurance company into bonds and into stocks and into any other developments that the industry invests in, and a portion goes to covering the cost of your insurance. And my bill says this: it's fine that they invest it, but if they're turning a profit on your initial premium policy that you put down, that a portion of that investment, when it turns a profit, should be used to lower your premium.
that's a good